quick solutions to reduce cold in children. Generally, there won't be any quick solutions or shortcuts to reduce cold in children, but you need to see why the cold is happening for your kids. It is a most common complaint, and again, a most common complaint for the pediatric age group coming with cough. So you need to see why the cough is happening, whether it is because of any underlying infection, or is there it is becoming coming because of any throat irritation, because of any allergic stimulation, or is there any underlying cause because of the reflux of the gastric content. So you need to visit your doctor first and check it whether it is not because of infection. In case if it is because of infection, it could be either because of throat irritation, mild throat irritation because of the infection, or it can be because of any pneumonia underlying also. So we need to get it treated very quickly in case if it is pneumonia, so that you don't miss the valuable time. In case if it is not associated with any fever and child is very active, but there is mild cough or a lot of cough, especially more in the morning times, early in the morning times, then you need to think of any allergic thing. Generally, for the parents who are having already, if they are having any history of allergies in their childhood or at present, and the child is having lot of cough, especially early in the mornings or after sleeping, then you need to think of any allergic etiology. So in that case, again, you need to visit your doctor, give them a proper history, and you need to see is there any stimulating agent which is causing cough for your child. So if there is so, then try to avoid that etiological agent or any stimulating agent. For example, you take generally is there any allergic etiology, then stimulating agents most commonly will be dust especially, or any cold weathers, or any particular type of foods which the child is allergic to, or any exposure to cold weather or cold blow of air that causes, or any pollen grains. Generally, pollen grains are not visible to the naked eye, but during the pollen fall time, there will be a lot of complaints in these kids that they get a lot of cold when they go to external atmosphere. So on that note, then you need to avoid such stimulating agents. Automatically, it reduces the cold. This happens especially when the child is having chronic cough. Chronic in the sense it is staying for a long time without any other associated symptoms. In case if your child is having short duration of cough followed by fever, and once the fever has settled, they will get some cold, and cold is settled, but again cough is still persistent. Maybe persistent in the sense it will be persistent for a week or 2 weeks or sometimes 3 weeks also. Every time they get some fever or so, or in some infection, they get the cough will be presenting symptoms sometimes. On that note also, you can use some medications, but most of the times cough medications what we use generally are of no use or very minimal use, because they may not help the kid much. Rather, it may increase the irritability to the kid. So try to find out the actual cause why the child is having. So visit your doctor, and then you can use the medication. In case if they're not coming down, then you can think of any allergic etiology and try to avoid the stimulating agents, so that you can, again, you go to your doctor, try to, if your doctor prescribes any inhalers or any not nebulizers especially, but any inhalers, then try to not to refuse them. Okay, try not to refuse them. Generally, we will give a trial of inhalers for a period of 2 to 3 months to see the symptoms are coming down or not. So in case if your doctor gives an inhaler, don't refuse them. Try to understand the situation, use them regularly over a period of month to 3 months, and then see the response. If the response is good, your cough is coming down, then yes, go ahead with them according to the advice of your doctor, and follow the prescription accordingly, so that your child will have a cough free time. Thank you.